I got the diagnosis in November, and the first thing that the doctor said was, oh, you're probably going to have surgery and you're going to have your epidural. And I'm like, you get these people who get stuck that they're not going to be able to move and they're doing these injections. And I'm like, no, nope. I'm not doing it. It got to the point where I was getting like stomach cramps because of all the ibuprofen and stuff I was taking. So it was constant low back pain. You go from point A where you're just terrified of moving to, where I'm at now, and I don't even think twice about it anymore.
What percentage do you feel like you're at right now, just within the first half?
I'm like 80%. Like awesome. I really do feel 1,000 times better. Even the first consultation we had, I haven't dealt with the sciatica. My foot doesn't go numb anymore.
It's incredible. In only 3 months. And that's because of you. That's because you put in the work.
I'm not afraid to move anymore. I've never not woke up with lower back pain, and I didn't wake up with any low back pain. I can go back into a gym with the knowledge that I have and not be afraid of like, am I gonna hurt myself again? I woke up pretty excited just to know I can do this and without being afraid. That's all the guidance, because you think you have to fine tune it sometimes. That's all it takes.
At this point in time, we know we prevented any surgery from happening. Someone as motivated as you and as dedicated as you are, yeah, there's no choice but to succeed.
I can't be 60 and not be able to move. Like, yep. It's just not an option. It's really not an option. The program works. It really does. And it really has given me the confidence I need to be able to just move. I'm not afraid to move anymore. With the initial diagnosis, you herniated disc. What I cannot do anymore, and I don't have those thoughts. I can get up and I can go and I can live my life. If you do the work, you get the results.